So what I find with clients is that oftentimes they're not ready to commit to the cost of the procedure or to the resources of time, money, and emotion into the procedure until they start getting fearful that they're not going to get a positive outcome. To simplify it, they might say, let's see where we are in 3 months. If it doesn't work, then we're going to do stem cells. How long is too long before stem cells might not be effective?
So when we first started out, I actually told people in equine practice that these older chronic tendons and ligaments, I said, I don't think it's going to help very much. It's already got mature scar tissue, and you may have re-injured again already, which typically happens. You've treated conservatively, you've done shockwave or something, and now they go back to work and they tear again. They're sore again. We got pushed by clinicians like you to try some of those more chronic cases. And in fact, I am shocked at how well it can work even in a chronic case. So I'm a believer in early therapy, so I think blocking the scar tissue is better, but these cases where you've got significant pathology already, so it's significant, even some of these big bows, you got a big banana bow, and you go, can we help at all? I have seen some amazing ones with owners and veterinarians who pushed us to say, could we try? And I cautioned them and said, be cautious in your prognosis. I don't think you're going to get back to normal because you've got so much scar tissue. But a very significant number of those still were helped in a major way and could get back to work. So I think it really is worth a serious consideration on those. Better not to wait 2 or 3 years until they literally can't work at all. But if you're out 3 months and you've tried conservative and your ultrasound's telling you it's not healing like I thought, those are very legitimate cases to come back and treat with ultrasound guidance. Go to the area where you still see the lesions in the tendon or a ligament. These chronic suspensories that are the bane of your existence, you can't keep them in work. Those actually are really good cases to go back, put the cells right where the injury is, and expect reasonable outcomes. So I think it really is. It's a very good question. The typical horse I know you see all the time, Roland, where they're a jumper.
Yeah.
They're a Western performance horse, so they're trying to slide stop and things like that. It just, tears the heck out of those suspensories. Yeah. And you lay them off 3 months, you treat with whatever, everything in your bag of tricks. They look pretty good, they seem sound, they start them back up slow, and as soon as they get towards full performance, bang.
Right about the week before they're at where they want to be, it happens.
That's exactly. Those are ones that I would say, treat them aggressively with your rehab and your standards, put the cells right in there. You might even need a second dose, but tell those people, okay, so if you're going to make now a last run can you keep them in work? You can't rush it. If the owner will dedicate and follow your ultrasound follow-ups and rehab program, it's surprising how well they can do.